This week on Healthy Living, we'll look at prostate cancer, a commonly diagnosed cancer in men. A new report finds prostate cancer cases will rise worldwide by 2040. We'll have more. And Nigerian oncologist Professor Bello Abubakar Mohammed discusses challenges and opportunities in the fight against prostate cancer in Africa. Plus, what is the best food to reduce the risk of prostate cancer? These stories and more coming up on this edition of Healthy Living. Hello, I'm Linoch Moudou. Welcome to Healthy Living. It is a devastating diagnostic faced by millions of men globally. Prostate cancer is one of the most common cancers in men. More than 1.4 million people were diagnosed with prostate cancer in 2020, and over 375,000 died from the disease, according to the International Research on Cancer. The mortality rates of prostate cancer was 2.7 times higher than global averages in sub-Saharan Africa in 2021. The prostate is a vital element of the male reproductive system. If left unchecked, the small gland can lead to big problems. Early prostate cancer often has no symptoms. However, problem urinating, blood in the urine and semen, and bone pain are some signs of cancer of the prostate. New analysis by the Lancet Commission suggests prostate cancer cases will double by 2040.
Masters athlete Joe Appiah, renowned for holding multiple European and British records in hurdles, found himself facing an unexpected opponent in 2021, prostate cancer. Reflecting on his journey, Appiah recounts the situation.
In a way, I'm lucky. I didn't have no symptoms. I wasn't really aware of prostate cancer. But my friend gave me a call and said, I've got this cancer. I said, what do you mean you got this cancer? I mean, he's a similar age to me, and he's also fit and healthy. We knew each other through sport. So I was shocked, but he encouraged me to go and get tested.
Prostate cancer is the most prevalent form of cancer among men, constituting approximately 15% of cancer cases worldwide. A recent analysis by the Lancet Commission projects a significant surge in annual prostate cancer cases from 1.4 million in 2020 to 2.9 million by 2040. Professor Nick James, an expert in prostate and bladder cancer at the Institute of Cancer Research, London, and consultant clinical oncologist at the Royal Marsden NHS Foundation Trust, underscores the grim reality.
There's around 1.4 million men diagnosed per year with prostate cancer at the moment. That is set to approximately double in the next 10 to 15 years, and almost all of the extra cases are going to occur in low and middle income countries.
Experts say governments must proactively prepare to address this rise in cases by establishing robust systems for early diagnosis and treatment. Additionally, raising awareness plays a pivotal role.
So raising awareness is a key component of this, and one of the things we highlight is the use of things like social media and smartphone-based technology, both as a tool for disseminating information, because people are very plugged into things like TikTok, Facebook, all these things, but also as a tool for managing them as well, because you can run people's medical records on smartphones.
The 2020 GlobalCan program data indicates that cancer of the prostate is the second most diagnosed cancer in men from sub-Saharan Africa. Observers say the recent deaths of African Americans Lou Gossett Jr. and O.J. Simpson, less than a month apart, serve as a sobering reminder that black men are more likely to be diagnosed with prostate cancer and die from it. Prostate Cancer UK reports that 1 in 4 black men will be affected in their lifetime.
The good thing is my one has been caught early, and when they did the follow-up test, which was the PET scan, So when they do a PET scan, is to find out whether the cancer has spread from the prostate area. When I did that, mine was within the prostate, so which means that they can do something about it. It gives me much more treatment options.
As Appiah's story demonstrates, early detection through proactive screening can significantly improve treatment outcomes.
Professor Bello Abubakar Mohammed is Chief Consultant for Clinical and Radiation Oncologist at the National Hospital in Abuja and the Chair of the National Comprehensive Cancer Network Harmonized Guidelines for Sub-Saharan Africa in Prostate Cancer. He discusses steps to prevent and treat prostate cancer.
The incidence of prostate cancer in Africa is really difficult to say for so many reasons. We don't have institutionalized screening programs. We don't have cancer registries across African countries. And indeed, there is no presence of cancer care at all in 22 out of the 54 African countries. And it is important to note that prostate cancer is the #1 cancer in men in sub-Saharan Africa. So that is the incident that we really need to know, not the figures. And it is expected that this incidence will continue to rise, that by 2030, the incidence would have risen to such a magnitude that it will take an epidemic proportion, except something fundamental has happened. Some of the symptoms are usually around the urinary tract, because the real culprit that causes it is the effect of a hormone called testosterone. Okay, that is the male hormone. That is what gives a man virility, it makes him a man and so on. You will also have even painful urination. The easiest way to confirm if someone has prostate cancer is by doing a simple blood test called the prostate specific antigen, that is PSA. That can save one's life. And we know also that prostate cancer becomes more prevalent as someone gets older. So you start to do the prostate specific antigen testing from the age of 40, because 1 out of every 4 men, black men, will develop prostate cancer in their lifetime by the time they reach the age of 80. I think we have a lot of work to do in creating awareness that people need to go to hospital for prevention, screening, and we must also insist that government must institutionalize screening programs. Prostate cancer is an indolent cancer. It is slow growing. So if you detect it early, you can live with it 40 years, 50 years without having any problem. But most of our patients, 86% of our patients are presenting very late when they already have metastasis, when it has spread. And even as that, it is possible to cure prostate cancer.
How aware are you about early signs and steps to prevent prostate cancer? And what do you do to maintain good prostate and overall health? Here are some reactions from Mombasa, Kenya.
According to my knowledge, many men suffer from this disease, and when you ask them why not go to get treatment, they believe it's voodoo or witchcraft. This disease is for men, and there is no cure for it. Most people don't know about it due to poor education and a lack of understanding. But if they have read and are educated about the disease, it would be easier to get treatment. Many have died because they believe it's voodoo.
This is the first time I'm hearing about this disease. I've never seen anyone with this disease, nor have I witnessed something like this.
I hear men who have prostate cancer fail to urinate. Now, in my own study, yes, I know that prostate cancer poses such a problem, and its symptoms are present as such. I personally have never done a diagnosis on prostate cancer, but I have heard it has bothered many people. For example, the late Mandela got this disease. The current US Secretary of Defense has it. So it's a disease that affects men.
I didn't go to get tested because I never suspected myself of having the disease. Because in my daily movements, I've never felt pain or anything that would make me feel like I might have this kind of illness. But the other reason is, when I'm on the street talking to my friends about the procedure used to test the prostate, I'm afraid because I hear it's not very exciting.
The disease makes a man swell in the genitals just as women swell in the breasts and legs. Sometimes I hear the disease is caused by mosquitoes.
Mohammed Maika Didswere received a stage 4 prostate cancer diagnosis in 2022. Since then, he has undergone continuous treatment. He credits early testing for saving his life and passionately advocates for others to prioritize regular screenings.
I've been on checking myself at Princess Royal University Hospital. So when they did all the testing, in the period of midnight, around 11 o'clock, the oncologist doctors, they came to me and they said to me it might be prostate cancer. It was difficult for me to swallow it. I can say to all the black community out there, just to say early testing saved my life up till now. Because from where I'm coming from, where I was born in Sierra Leone, where there is no better treatment for testing, a lot of our brothers and sisters are dying because of prostate cancer. But early testing saves lives. And when I'm unable to go to the gym or exercise, when the body is tired, I don't force issue. I don't do too much. I just relax. But I think by you exercising or going for 30 minutes walk and come back home, not just lying down on the bed or on the sofa, I think that one as well contribute to my well-being. When it comes to food, because sometimes when you're going through this treatment, your diet change. But as an African man coming from Sierra Leone, I still eat my traditional food, but there is limit on certain food that I don't normally eat because you have to eat to keep your strength because the treatment is not an easy treatment. I go to the healthy shop sometimes. Most of my money I spend it on the healthy shop and my exercise routine that keeping me fit. Because for example, last year during my chemo treatment, I was doing challenges, which is like 100 push-up challenge for the whole of my chemo treatment to raise money for prostate cancer research. But I just think that the early testing and the early screening saves life.
Maintaining a healthy prostate is critical for a man's overall well-being. The Alliance Urology Specialists says incorporating prostate-friendly foods can provide an additional boost to support prostate health. The experts say prostate-friendly foods include tomatoes, which contain lycopene, shown to help reduce the risk of prostate cancer and slow the growth of prostate tumors. Fatty fish such as salmon, mackerel, and sardines are excellent sources of omega-3 fatty acids, which have anti-inflammatory properties. Garlic contains sulfur compounds thought to help protect against prostate cancer and may help decrease your blood pressure and prevent blood clots. Beans, lentils, and peas are an excellent source of fiber, protein, and other various nutrients. Not only are legumes great for your overall health, but they also may help suppress tumor growth. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at @LenorMoudou. Until next time, stay well and strive to make every day a healthy day.